Good morning, everyone. On behalf of IEA, my name is Rafael Muya. I want to invite you to our 22nd pre-budget hearings. Yesterday, we had the opportunity to have budget proposals from the corporate sector. And as our moderator yesterday mentioned, today it will be the social sector where we will be receiving we'll be having an opportunity for the social sector. These are the NGOs where they will be able to make budget proposals with respect to their respective sectors so that we are able to synthesize as an institution and then share with the National Treasury. For the new members who are joining us, I just want to mention that the Institute of Economic Affairs is a think tank, and what we do is to provide a platform where we have discussions which can be able to influence public policy in Kenya. And our mission is to inform decision making in Kenya through policy innovations, research analysis, and of course analysis. Two things before we start this meeting that I want to mention is that one of the new development that has happened yesterday, and I think this morning the document has already been published, is that the BPS, the budget policy statement for the new government, has already been uploaded in the National Treasury. And the budget policy statement, what it does is that it presents priority programs and policy and reforms which are supposed to be implemented by the national government. And what it does is that it presents an opportunity where we as the stakeholders, whether it is the corporate sector or independent the social sector, where we can be able to share our submission in the various sectors that we work in. And therefore, this presents again another opportunity where we can be able to engage with particularly the National Treasury officials, where we can be able to share our concern in terms of the programs that we are supposed to present. Number two is that during the implementation or during the budget cycle, I think this opportunity, which is offered by the Institute of Economic Affairs, is an opportunity where we as the stakeholders are given an opportunity to give submissions as provided for by the National Treasury in terms of guidelines. And therefore, it offers an opportunity where you share with the Institute of Economic Affairs your budget proposals, wherein we are able to synthesize the same, and then we make submission to the National Treasury if we are able to follow the guidelines that are provided by the National Treasury. And therefore, for this today, we have a couple of presentations that we are going to receive, we have 4 presentations, and for a start off, we have a presentation from the East African Child Network, and the presenter is Anita Otieno, and she'll be making a presentation on child rights responsive budgeting to add enhanced investment in the rights of the children. So basically, she'll be making submissions or budget proposals with respect to how responsive our budget toward the children's rights, or how the government invests on the children's right. Number 2, we'll be having a presentation from Josiah Carey. Josiah Carey works with the Collaborative Center for Gender Development, and he is a monitoring and research officer, and he will be making a presentation on promoting economic recovery and growth for the medium-term expenditure framework for the financial year 2023-2024 up to the financial year 2025-2026. And the focus will be on care work in the social service related sectors. And then number 3, we'll be having a presentation from the health sector. And basically, it will be from Jemima Mudhoni, who works with the Health Rights Advocacy Forum. And basically, she will be making submissions on budget proposals with respect to the health sector, focusing with a focus on the mental health. And finally, we will be having a presentation from Dr. George Orido. Dr. George Orido works with, he's a director, and he works with the Institute for Creative Industries in Kenya. And basically, he will be sharing some budget proposals on what does the plan has, or what does the government have with respect to budget, with respect to priority areas on the creative industries in Kenya. So those are the four presentations that we'll be having today. Jemima, if you are ready, you can go on, please.
So good morning, everyone. I'm Jemima. I work with Health Rights Advocacy Forum. We are an advocacy NGO working in Nairobi, Nyeri, Kilifi, Machakos, and Isiolo. Basically, we do advocacy for health policy and budgets, and we are also keen on promoting social accountability initiatives that are community-led. I'm based in Nyeri County, and I wish to share my thoughts around this medium-term planning phase. To start us off, the health per capita spending and share of public expenditure for overall health has been reportedly, it's been reported in the sector working group reports to have increased from USD 20.5 to 88.4. That is a percentage of 28.6% to 42.1 respectively. That means there's been an increase in health per capita spending of 28.6%. And as a share of public expenditure, total expenditure of the total public budget expenditure, it stands at 42.1%. Overall health spending has increased to 9% in the period up to 2018. This is still below the Abuja Declaration commitment for 15% so many years down the line. Again, we've also seen significant out-of-pocket expenditure as high as 23.6% of total health expenditure. Then even as we see promising increases in health expenditure, we are still seeing underinvestment, especially in what I tend to call the forgotten priorities in health, especially mental health, investment in community health services, human resource for health, and of course in addressing systemic challenges that cause massive losses in health revenue. So for this phase, I think for us, we'll be looking to advocate for investments for preventive and promotive health. Down the line, this intervention will bear returns in terms of a healthier population and one that's able to economically engage. And of course, since we are 7 years shy of the 2030 vision, timeline for Vision 2030 projects, that the flagship projects be prioritized for implementation, and this will promote realization of UHC and reduce catastrophic spending on health. So the context in which Treasury is planning for health in this phase, largely health sector planning is informed by the guiding framework of the Vision 2030, the medium-term plan, the Big Four agenda, the COVID-19 economic recovery strategy, health sector framework, policy framework, the strategic plan, and all these are geared towards achieving UHC aspirations. So for us, in looking at the flagship projects, largely there is the locally derived natural health products. This is an area of interest in promoting use of alternative medicine. And there has been progress made towards this because there is already a traditional and alternative medicine bill underway. But going forward, there is need to refine existing regulatory guidelines so to allow for registration of natural health products of acceptable varying standards of processing. These now will provide the same controls for alternative medicine as exists for other pharmaceutical commodities. The other key area is modernization of the Kenyatta National Hospital and Moi Teaching Referral Hospitals. This is towards highly specialized referral facilities. So there's a master plan for Kenyatta that includes equipping over 300 bed private wing, a 2,000 accommodation units and conference facilities to promote health tourism. These aligns to the national treasury aspirations that towards promoting sustainability in health financing. Towards this, the Margaret Uhuru Hospital, pediatric hospital under Kenyatta is already up, and I think there's progress towards operationalizing that. Under Moi Teaching Referral Hospital, there's also been significant investments in construction for a biosafety lab and isolation center. There's also been some investment in chronic diseases management, specifically acquisition of radiotherapy, cancer-related equipment. So again, under Vision 30, there was the proposed upgrading, construction, and equipping of level 4 hospitals. So these are key projects for us to push for as we near 2030 timeline. The last medium-term plan had also highlighted expansion of health protection services, implementation of the Linda Mama project, establishment of 10 new referral hospitals and 4 cancer centers, expanded managed equipment services to an additional 120 hospitals, local manufacture of HIV commodities, and inclusion of HIV in the benefit package of NHIF, and of course, increasing antiretroviral therapy coverage to 90%. Of these aspirations, what has been achieved is a completion and commissioning of the Kenyatta University Referral Hospital and the Othaya Level 5 Hospital. It's a Level 6 hospital in Nyeri. The equipping of the mother and child unit at Kenyatta, construction of the biosafety lab, an isolation center at Moi Referral Teaching Hospital, the integrated molecular imaging center still at KU Referral Hospital, and this is towards increasing investments for cancer diagnosis, treatment, and care. And then the construction of the regional cancer centers in Nakuru, Mombasa, Garissa, that's already been completed, but there are some that had been deferred, like Kakamega and Meru. So again, for us, the ask will be that this is also prioritized by 2030. Then construction of East Africa Center of Excellence. This is under the EAC. And it's envisioned to promote medical tourism. It's at as at 2021 was at 40% completion. I'm not sure where that is at as of now. So again, we have a new government political dispensation, and under their manifesto, they've committed to realization of UHC, and largely they are looking at all Kenyans being on NHIF coverage. They're looking at employment of community health volunteers. They're looking at bridging staffing gaps for skilled health, human resource for health, improving on access to emergency treatment, a commission for healthcare workers, and a bit of the rest of it lies around the co-funding strategies. These will replenish the global fund for HIV, TB, malaria, And that also, and additionally, they've added blood transfusion, sorry, family planning. And then of importance is ring-fencing funds for healthcare. From facility improvement funds. This has always been a problem at county level because all funds go through the county revenue fund, and there's a big risk of health resources ending up where there is political mileage. For instance, in the counties we see a lot of maraming. Then reducing the cost of treatment, and the KEMSA changes to improve on commodity supply, and of course adoption of ICT for health. So we'll be pushing our agenda and referencing it to that manifesto, because in the past we've seen these manifestos weigh a lot on how decisions and resources are appropriated. The medium-term 4 plan prioritizes NHIF coverage that aligns with the manifesto, expanding existing health infrastructure, recruitment of health care workers, supply chain management, and of course, attracting investors for health products technologies. So this nicely aligns to that manifesto, and it becomes easier to make rallying calls for our asks. Next slide. So even as this framework exists, we are cognizant of the uneven economic recovery. We've just come from a general election. There is an emergence of new COVID-19 variants, and I trust that we'll never go back to where we were in 2020, but there's always that risk hanging over our heads, the disruption in life, socioeconomic activities. Then there is infrastructure and human capacities gaps, and these largely affect how well the health sector is able to achieve its goals. There is inadequacy in legal and policy framework to regulate the sector. Inadequate funding, climate change is becoming an issue, and again, we have to think of climate change and its impact on especially mental health, and the huge pending bills in the sector. And under PFML, the Public Finance Management Law, pending bills take a fast charge. So this means that a lot of resources that would have gone into development are not getting there. There's stifling of health development as a result of huge pending bills. Again, there's also the concern around health budget absorption. The sector working group report 2022-23 indicates that the absorption rates since 2019-20 have reduced from 90% to 80% to 84% as of the financial year 2021-2022. Again, there is the executive order of 2023 that has essentially reorganized the sector into two departments with distinct roles: the Department of Medical Services, the Department of Health Standards and Professional Management. And this is interesting to see how again this plays out at county level and how it affects resource distribution. So this essentially looks at what are the functions of the two departments. The Department of Medical Services will take lead in policy, curative services, pharmacy medicines control, referral services, cancer management policy, medical research. For the Department for Public Health and Professional Standards, we look at public health and sanitation policy, preventive promotive health services, policy, HR development, health education, food quality, quarantine, radiation, immunization control, and protection of HIV/AIDS management. So even as we work in this space, then we will realign our asks to just make sure they get to the right desk. If we could move on. So our proposals, our ask in this financial year is one, development of equitable financing mechanisms. So the NHIF becomes the vehicle that delivers UHC, and as a means of financing curative and rehabilitative services. Then the government health system needs to concentrate on prevention, research, and policy, so that now NHIF, if this works very well, then we're able to see a lot of health like a separation of. I know there is a pilot that had been done on output-based approach system in Kiambu, Kisumu, and I think Kitui, on delinking government health system and NHIF, so that NHIF now becomes a nice vehicle for handling health financing. So this has to do with what they do, the pre-qualification of facilities, the pre-authorizations, the payment for services that are satisfactory. The other bit is anchoring in policy the requirement that all health facilities are NHIF accredited. At the primary healthcare level, we've seen a lot of underinvestment because, for instance, in counties where we implemented UHC like Nyeri, all services were free. So now bringing back in the user fees, and in facilities that are not NHIF accredited, again, denies these primary healthcare facilities an opportunity to have a control over their money. Because with NHIF accreditation, then the assumption is that there'll be changes in policy to allow direct disbursements of resources to health facilities. In this, I'm looking at how well can amendment to the PFMA Act and related regulations to allow for direct disbursement of health resources to facilities. This, like I mentioned, allows for health resources to meet health needs as opposed to being moved to other sectors. Then even as we see the potential in NHIF and unlocking financing for health, we comparatively public sector gets less in terms of NHIF reimbursements compared to the private sector. An assessment done by ABP Kenya showed that 65% of NHIF reimbursements went to private facilities as opposed to 20% to the public sector. And a lot of this has to do with the private sector will have a dedicated officer who ensures that there are timely notifications, there is follow-up on payments, while there seems to be no incentives in the public sector to pursue these reimbursements. This becomes a loophole for lost opportunities to make revenue. Then there's need to increase resourcing to undeserved and disadvantaged areas. Again, towards reducing existing inequalities. I mentioned the outbased approach system for health services, and this essentially would mean that as opposed to where the scandals that have plagued and inefficiencies that have plagued NHIF, that payment is only made if services provided are satisfactory. So this guarantees access, quality control, and value for money. I mentioned the issues around reviewing the Public Fund Management Act, and related regulations. Then there is need to empower health facility boards to manage and supervise resources generated locally and from the central government. This is, if funds are going to come directly to these facilities, then a lot of capacity strengthening has to be done to support efficiency in use of those resources. Of importance is ring-fencing of health resources at national level. We saw the conditional grant and a new revenue sharing formula collapsed. And again, there is also need to ring-fence devolved health resources, so that people have the counties have a guaranteed target for health financing. The other bit is promoting medical tourism. I think this is a place where a lot of investments have gone into. We've seen high level specialization in the Kenyatta, the KU Referral Hospital, KNH, Moi Teaching Referral Hospital. So again, this will spur investment and growth in the sector, and also promote training and retention of specialized expertise. Of importance is to delink MOH, from service delivery. The ask from healthcare professionals has always been Ministry of Health remains as a regulator, and there be established a health service commission separate from Ministry of Health, and of course this has to be done in a way that it doesn't subvert devolution. And then the service commission becomes the body that's mandated with service delivery, and Ministry of Health remains to do what they do best. This is hoped, with the service commission, this is hoped that it's going to re-engineer human resource for health. So we expect that this would promote effective management of an existing health workforce by again putting in place an attraction, retention, and motivation mechanism, putting in place measures for performance and competence health workforce, the appraisals, performance contracting, and facilitation of national capacity development. What's happening currently is that while training of health workforce is a national function, counties are spending a lot from their allocation to support health workers out on training. And this has always been a gray area that results in essentially a clawback on what has been disbursed for health. So the other bit is around the managed equipment system, the MES program. This lease expires I think in May 2023. And there was a proposal to extend it by 3 years, but that has not sat well with the Council of Governors, so it's still a space I think is in limbo. But for us, the ask could be that these agreements revert to the national government, so that they for especially for maintenance of these equipment, they contracted, let them keep the agreements and provide for maintenance of these equipment, or push the agreement as it were, as opposed to pushing it to the counties. So on mental health, the Ministry of Health has made inroads in terms of providing policy direction in terms of how best to prioritize and invest in mental health. There is a mental health policy. There is a costed mental health action plan developed, launched in 2021. We now have a mental health investment case, and we have a suicide prevention strategy. Now, referencing the mental health investment case, it's been established that the economic burden on account of mental health conditions on the Kenyan government and this is looking at the year 2020, was 62.2 billion, an equivalent of 0.6% GDP in 2020. Investing in mental health then will accrue productivity gains and social value of health worth 161.6 billion over a 10-year period. The investment case packages and makes a strong argument that there is value in investing in mental health, and over a 10-year period puts that at 161.6 billion. So for this financial year, our ask could be: one, we need a baseline survey for mental health prevalence. Inadequacy in mental health data has resulted in inadequacy in planning and resourcing for mental health. Nobody knows how many Kenyans have what mental health conditions, and how effectively to plan for their needs. The other bit, as we work in the counties, we've realized that the revised Kenya Essential Medicines list of 2019 uh, removed the psychotropic drugs from the order tools for primary healthcare facilities. Now, in terms of promoting community mental health services and improving primary integration into primary healthcare, uh, clients could be seen at the referral facilities where the specialized mental health workforce sits, or where the services are provided, and be able to access refill for their commodities from the nearest primary healthcare facility. Now, with this revised essential drugs list, then it means that these facilities cannot order for those commodities for their known workload. And of course, this poses a challenge because it affects compliance to treatment and essentially affects quality of life for persons with lived experience. Then again, Kenya is rolling out the WHO quality rights standards, and they have a training to that effect. And this seeks to promote quality care and respect for the rights of persons with mental health conditions. Then, with that in mind, there is need to align infrastructure and services offered to WHO rights standards, so that we are not seeing rights abuse within the context of providing health services. In matters of social health protection, our experience has been that this is an area that has excluded persons with lived mental health experience. So I think at a policy level, there needs to be affirmative action for inclusivity for persons with a lived experience. Our next ask is increased investments for NCDs. Based on my presentations, you can see a lot of investments have gone into NCD investments. So there are all these changes, infrastructural equipping happening at the specialized referral hospitals. Now, NCDs accounted for 43.5% of hospital beds in 2020-2021, and this was compared to 35.4% in 2017, and it's estimated to reduce household income by 28.6%. Despite this, the funding for SED is limited, with a 94% funding gap from the estimated 375 billion needed per the costed National NCD Strategic Plan of 2021 to 2025-26. So even as a lot of capital expenditure happens in terms of putting infrastructure in place for NCDs, there is the requirement for funding to actually provide services, because it's not enough to put an equipment in place. It needs supplies, it needs human resource, it needs the what I would call the soft core for it to be operationalized. So with a 94% funding gap, our ask this year will be that this gap is bridged towards ensuring that there is effective realization of value in the massive expenditure towards infrastructural development for ECDs. Our next ask is towards realization of the Vision 2030 projects. There needs to be enhanced procurement systems at KEMSA, and this will address the delays currently being seen. I think this is something that's already being addressed. Then learnings from UHC. We in Nyeri County, where the county was a pilot for UHC, the biggest challenge in commodity supply was in access to reagents for glucometers and what are these others called? So we had a challenge accessing reagents. And the issue was that even as KEMSA had supplies, but there was a mismatch between the equipment and the supply. For instance, the glucometer strips. You find Nyeri County, most of the glucometers were sourced from meds. The particular manufacturer where this was sourced has their particular strip to match their glucometer. So what KEMSA had in stock could not be matched to the glucometers we had. So for the pilot period, essentially this was one of the unmet areas in terms of commodity supply. The same happened with reagents and laboratory supplies. So there needs to be that provision for meds to compete for supply of medical supplies alongside KEMSA, and be able to effectively equip our health facilities. Then there's also need to refurbish and strengthen KEMSA regional depots. This is timely because a lot of them are in dilapidated conditions. Then the establishment of low-cost diagnostic centers and provide adequate screening and treatment facilities for persons with chronic and terminal conditions, including cancer, diabetes, kidney failure in every county. So these aligns to what the medium-term plan seeks to achieve. The manifesto of the current government, and there has been some efforts to create hub and spokes between. I know there's a pilot that was happening between Isiolo and Kenyatta, and looking forward to the learnings coming from there and seeing how this can be applied across board, as well as the regional cancer centers. So I've come to the end of my presentation.
Thank you, Jemima, for your comprehensive presentation on the health sector. And I will not be able to repeat what you have said, but in terms of a summary, is that what you have done is just to share with us. In the health sector, what you mentioned is that despite development, access to quality and quality health has been hampered by the issue of investment. And there is this call for adequate appropriation toward investment in the promotive, but also in the preventive measures. And then you have given us a context in terms of the Vision 2030, the medium-term plan, the Big Four agenda. But for Big Four agenda, I would say that we have a new government where they have got their own, initiative in terms of how they want to take the development agenda in this country. And then post COVID-19 recovery. And one of the key things that you have mentioned is that in terms of spending in the health sector, I think overall spending has been up to 9% of the total budget, which is below the Abuja declaration of 15%. And then you talk about the absorption capacity of the health sector, which has been declining from 90% up to 80%, which for me, I think that one is a concern. And then you talk about the pending bills, which is something that should be of a focus to the ministry. And I think that's one of the things that we need also to interrogate to see which kind of pending bills are there. And then from there, you share with us critical points in terms of proposals to the sector. You mentioned issues about equitable financing. You mentioned about ring fencing of the funds to the health sector, which is critical. And other proposals, which I think they will go a long way in ensuring that we improve the health sector. So I don't want to go into much, but as far as I'm concerned, I think those are some of the things that you try to bring out. Now, going forward, is that I know you have taken a bit of time, and we also need to give opportunity to the other three presenters and give opportunities to our participants. But as of now, as we go to the next presentation, I will request our participants, perhaps if you have a question, we have a chat box. Perhaps you could be able to pose your question, and then we see how fast we can be able to address the question. So for now, I will invite Anita. Anita, please, if you are able to maintain our 15 minutes, we will really appreciate. Welcome, Anita.
Thank you. So my name is Anita Otieno, and I work at the Eastern Africa Child Rights Network. It's an international NGO, regional within the Eastern African region that deals with advocacy for child rights. So in this presentation, I'm just going to focus on children's rights as per the Kenyan budget. So to begin, in Kenya, about 53% of the Kenyan population is children, and this is according to the latest reports of the census 2019. So we already see that children make up a very big percentage of the population. And then under the ministries, children fall under the State Department for Social Protection. And just to mention that children's rights are very diverse. So therefore they extend to various categories and sectors, which means children can touch on the health sector. As we've seen in the previous presentation, we had something on children, especially in maternal care. And then children also touch on the education sector. So children also touch on the judicial sector. So it's very diverse. And then from previous trends, we don't have children as an independent group according to budgeting or just grouping. Most of the time, children are assembled with other groups such as children and youth, children and women, and children and other vulnerable groups. This is important for context. So the legal framework for children's rights in Kenya, we have the Constitution of Kenya under Article 53. We have the Children Act of 2022, that was just last year. And then we have the United Nations Convention on the Rights of the Child. We have the African Charter on the Rights and Welfare of the Child. And then we have very many policies that guides children's rights. So I just decided to categorize children's rights into 4 from all these legal frameworks that we have. And this is borrowed from the UNCRC, which is right to survival, development, protection, and participation. So just for context, survival could mostly is health, nutrition, right to life. So under the right to survival, we notice that more than half of the population of Kenya are multidimensionally poor and deprived in the realization of at least 3 basic needs, services, and rights. So of these, children comprise the largest share, which is 48%, followed by the youth, which is 25%. And right to development, we'll have this right to education. We see that reports show that close to 35% of secondary school students will not complete the education. And currently, about 2 million children of the school-going age are out of school. Under child protection, research shows that an overwhelming majority of children who come into conflict with the law are victims of neglect, exploitation, psychological and economic hardships. So these are children who come into conflict with the law, or even sometimes just in contact with the law, like let's say during custody hearings and etc. And then under child participation, which is also a very important principle, there are guidelines for child participation in Kenya, but these are largely neglected. So children's participation in decision-making and the engagement with duty bearers is still very minimal. So for the past budget trends, the budget for the last financial year, that 7.8 billion was set aside for social protection of vulnerable groups. This is where children fall. And then out of this, just about 933 million was allocated to children through the Child Welfare Society of Kenya. So already this percentage that is given under the whole umbrella of social protection is less than 2% of the total budget, which is very far from the minimum standards that are supposed to be allocated to the social expenditure. So we see that this is a very low investment by the government. And then we also see that this amount rarely increases. It's only last year that the National Safety Net Program increased the budget a bit due to COVID-19. But then the last financial year, it was not maintained. So we went back to this allocation of funds. So under the social expenditure, just to show that the budget allocation, the source of this is the United Nations Office for Human Rights. There's a share to the health sector, to the education sector, to the social protection, and then to WASH, that's water and sanitation. So the education sector, of course, gets the giant chunk of the budget. And then we see social protection is very minimal. And remember, social protection comprises the youth, the elderly. Yeah, so children are just a part of it. So from that context, what are we requesting for? Our proposals is number one, increase the share of the budget allocated to social protection. So we already see that only less than 2% of the budget is allocated to social protection. Yes, we agree that there's health and there's education, but then there are other rights of the child that we need to see, and in order to achieve Vision 2030 and even just the SDGs, there are other rights like the right of children to play, which means we need sustainable cities and communities. So this needs to be allocated for. There's the right of children to grow, develop. In other ways, there's like very many various issues that don't necessarily fall under. When we look at the budget expenditure, we see that a lot of it just falls under protection and survival. Yet we've seen the other rights like development, and then there's the right to child participation. So most of the time, there's no budget to cater for these things. Number two, allocate funds for implementation of existing laws and policies. We have very good laws, we have very good laws on children's rights, but the implementation is very poor. And then we have very many policies, and most of the time the people who support the implementation of these policies are donors, foreign donors, and so NGOs mostly. So we need government investment in this. And just as I mentioned, we have the Children's Act, which was only passed last year. It comes with it very many things like establishment of institutions, like caregiving, etc. And to implement this, we need a budget for it. And we see the budget is very little, which already goes to just child protection. So we need to diversify this. And then number three, to embrace a multi-sectoral approach in allocation of resources that promotes the rights of the child. So as we've seen, children fall under various sectors. And the example I'll give here is the judiciary. When the budget is allocated to the judiciary, children get the least part of it. So we see, I'm sure we've had instances where children offenders are put together with like hardcore criminals, etc., because there are no child specified, I don't want to say remand areas, etc., because it's very wrong already to put children together with that. And we see that the judiciary sometimes does not have money, for example, to help children who may not have the means, for example, fight child custody questions, child abuse, etc. So we need the budget to be very conscious of the children when the allocation is being done under each and every sector. And then to increase the sensitivity of the budget to the rights of the child, which of course ties to my point, because if you focus on equity and inclusion of children, you see, like, children are barely catered for in the budget. I think that they get a very meager percentage of the whole budget. So we have vulnerable children, such as children with disabilities, children on the street, children without parental care. We appreciate the fact that the NSFP is catering for orphans and vulnerable children, but we need to see that more children are catered for within the budget. And then number 5 is to improve fiscal transparency and accountability of public expenditure. This is the fact that in as much as you add more funds to a certain sector, if the funds are not expended as they should efficiently, if they're not disbursed at the right time, and if there's no accountability, then there'll be no movement, there'll be no growth. So people just remain where they are. Yeah, so in conclusion, spending on the social sector is very crucial for the fulfillment of economic and social rights, reducing inequalities and achieving Vision 2030, and also realizing the SDGs. Overall, the budget should be child rights responsive to fulfill the rights of the children as per existing laws, policies, and international best practice. So investing in the child is investing in the society, because we always say children are the future, but also not to forget that in as much as children are the future, they're still children in the present, and we need to cater for their needs. Yeah. So I'll finish with this quote. There can be no keener revelation of a society's soul than the way in which it treats its children. So looking at the expenditure and the budgets in the past trends, how are we treating our children? Are our souls pure? Are they dark? So we need to cater for children right now, because it is easier to build strong children than to repair broken men. Thank you.
Thank you very much, Anita, for your comprehensive presentation on investing in our children. And seated here, what I hear you say is that the majority of Kenya population is children, and that if you look at the various sectors that we have in our economy, you find that issues to do with the children, you can only find them in the social protection sector. And then when you go to the social protection sector, most of the issues, particularly on programs or even in terms of budget, you find that you are not able to identify which budgets go to the children. What you see is that there are budgets to do with the youth, vulnerable groups, women, and there are no budgets specifically meant for children. But then you go further and say that if you look at the legal framework, it is very clear, starting from the Constitution of Kenya, if looking at the Children Act, looking at African Charter on issues to do with the children, it is clearly states that we need to take the children, they are well taken care of. And then in terms of looking at the context, in terms of the trends, in terms of how resources are allocated toward children, is that if you look at the trend, even in the social sector, is that the budget allocation toward the social sector has stagnated over the years, and then you go ahead and try to share some proposals in terms of then what we need to do. But I think the most important part of it, and that's perhaps something we will share, is that we need actually to have a candid discussion with the National Treasury, and even we go to the sector working group and say that we need to have specific charts of accounts dedicated to the children, so that we can see budgets. If you're talking about investment on Child Welfare Society of Kenya, then we need to see specific programs which are dedicated budgets or money that is dedicated toward children, so that we can see some level of investment in the children's right. So thank you very much, and I think we'll be having a chance to hear from the participants. But right now, I haven't seen any comment, and I would like to encourage our participants perhaps to react you can share your concern, a comment, or even a question, so that moving forward, when we reach to the Q&A, it will be easier for us to address some of the for your concerns. Now, going forward, I know time is not with us. I would like now to request Josiah. I don't know, Josiah, are you able to share your you share your presentation so that we can move forward?
Thank you very much, Raphael, and IEA for organizing this. My name is Josiah Kiari, and I work for the Collaborative Center for Gender and Development. We are a policy advocacy organization working for promoting gender equality and non-discrimination. I also coordinate the Kenya Gender Budget Network that seeks to promote gender-responsive budgeting as a practice for county governments and national government. So my analysis today is focused on the sector working group proposals for the financial year 2023-24, and also extending to 2025-2026. And the focus specifically is on the social service sectors, and in particular education, health, social protection, governance, justice, and law. And also making additional proposals in other sectors that impact on social services. So as a background, so we have seen recent happenings in the global economy, or and also other issues to do with war in Russia, Ukraine, the prices of commodities rising, climate change impacts, and this has impacted on the Kenyan economy, and also impacted on the lives of women, men, boys and girls in Kenya. So those are some of the things that lay a basis for why we are asking the government to consider investment in the social service sector, because during these times, people rely on the social service sectors for their care. If you remember, during the height of COVID-19 pandemic, there was an increase in the number of persons who spent time in the homes, and even amongst men, evidence is there that even men took up some of those household responsibilities. However, this is what women have been doing for a long time, doing house chores, domestic work for quite a long time. So we have seen an interest by the government to offer policy responses. We have seen the COVID-19 county socio-economic reengineering and recovery strategy. And it has specific focus on health, education, water, social protection, and gender, among others. It says that these are the anchor sectors for the country to recover from the shocks that happened during the COVID-19 period. The manifesto of the current government has also identified socio-economic empowerment for those at the bottom of the pyramid. We are justifying this by saying that care responsibilities, and by care responsibilities, we mean work that is done to nurture other people. Meaning that if for instance, if you have a husband and a wife, and the husband is going to work, the husband has to eat, the husband has to wear clean clothes, and this work is being done by someone else without compensation. And this person could be the wife, or even if this household has a domestic care worker. Often the times you will find that the amount of money paid to this person is way below the minimum wage. So care responsibilities, taking care of children, cooking, cleaning, fetching water, these have a huge impact on women's labor force participation, their participation in leadership, and also contributes to other things like a wage gap. So the Kenyan government, the priorities for addressing this are both on social service kind of related interventions, which means education, health, and also as physical infrastructure. and especially that is related to piping water, bringing water close to people's homes, affordable energy like electricity, ensuring that people have clean sources of fuel to use like LPG in cooking, and time and labor saving equipment. If you have a laundry machine, perhaps the time you spend cleaning is reduced significantly, and you can spend that time doing other things. The government also recognizes that development of physical infrastructure, as I said, is critical for reducing the toil that is associated with the time spent on this work. And just to mention that the government is currently developing a policy on unpaid care and domestic work, which seeks to provide policy direction towards addressing unpaid care work, mainly recognizing, reducing, redistributing unpaid care work for women and girls. So these interventions will make Kenya to reap the economic benefits in the care economy. And this value is estimated by the ILO to be between 10 to 39% of the GDP. Also, the Kenya National Bureau of Statistics has commissioned, or in 2020, commissioned a study, the time use, a study on the time use in 2021, which seeks to, among others, measure paid and unpaid care work. And I like what Raphael mentioned about the national accounts. Perhaps it is time we also have one for this as treasury, so that this can be incorporated into our economy, because as it is now, it is not recognized despite its contribution to nurturing human capital. So we move now to what has been happening, and this lays a basis. Last year, we saw that the most unprioritized sectors were those that address unpaid care work and development. And we're talking about education. Education, because if children are at home, they are probably it is the women, their mothers, their sisters, aunties that take care of them. Health, when people are sick, most of the times, you will find it is women who are taking care of sick people at home, persons living with disability, etc. So we saw that compared to growth in the sectors, a comparison of how the sector grew from the previous year, we saw that education, despite being the sector that is allocated the highest amount of funding, its share was 26% of the 2021-2022 budget. And moving on to 2022, 2023, there was a reduction of a negative one from 2020, 2021, 2022. And this is critical, because when you think about the amount of resources that are spent in education, you would think that they are high. But if you compare the share from one year to another, you will find that there are significant differences that point to the prioritization of certain sectors. For instance, the second, energy infrastructure and ICT. From 2020, moving on to 2021, 2022, there was a reduction of 2% in the share for that sector. I think my apologies. There was an increase. Sorry, the negative should not be there. It was actually 2%. So the other comparison is on the other sectors, and in a nutshell, if you look at from moving from 2021, 2022 to the last year, only ICT had an increase in the share of the budget. The rest of the social service sectors the deviation is 0%, meaning that they still got a share of the budget as they got in the previous year. That is what is meant by this analysis. So this clearly points to a prioritization or deprioritization of the social service related sector, which is something that has implications on unpaid care work, women's labor force participation, and overall economy. So, and why we think the government is doing this is because during times of economic downturn, this becomes soft targets because most of the work happens in the households. So you never get to see it visibly, but there is work that is happening in the background that is unrecognized. So in the sector working group proposals now, just that were presented last week, focusing on the education sector, we see some of the key outputs and targets that the sector wants. And I will skip this because of time and go straight to the issues that we have identified. So what are the key issues? Number one is on the early learning and basic education program. It targets about 7.888 million for enrollment in children in primary school, which presents a 1 million drop from the target. They're targeting a lower number. And we are considering that the number of children in primary school is 10 million in Kenya, based on the economic survey. Reduction in the targeting of the number in this year's, in the 2023-24 budget, means that the burden of caring for those other children will be transferred to women and the Kenyan households. Another issue is that the target for the newly trained teachers is 22,000, which has not changed from the previous year. Even when the student enrollment has increased, when you combine secondary school, junior secondary school, this is a concern, because it means then the teacher-student ratio will again not impact positively on the quality of learning. The other issue is that apart from early child development policy monitoring in the counties, and we are looking at how is the education sector taking care of all children, regardless of their age. We see a focus of children who are above 3 years. Their needs for development and care. You see, you have children going to schools and they have this free school meals program. We have other interventions around hygiene, water, and sanitation in schools. But these children who are 0 to 3 years are at home. They need stimulation, care, and development. But this has been left to the women and girls mostly in the household. So the ACD framework partly is contributing to this, because if you see what it recommends as care for children 0 to 3 is mainly health interventions, but we are saying that there are other interventions that would impact on human capital development even at this early age. So we have pointed that out. The other issue is that while while primary and secondary education is near gender parity for both boys and girls, meaning that if you compare the number of females and males in the lower levels of schooling, you would find that they are near parity. This is not the case in TVETs and institutions of higher learning. Male students account for 52% of TVET enrollment. And it has been observed that the low number of women in TVETs and universities is partly due to the unpaid care work and domestic work responsibilities that they take up, either because they became pregnant along the way, they got married, They have a child, and so they have to drop employment and make certain sacrifices so that they contribute to human capital development. So the proposal, and one of the things we're observing is that for us to promote education, higher education for females, it is essential that we address the intersecting needs of female learners in higher education so that we promote education attainment. And attaining higher education is also opens up more economic opportunities. So it is quite a discriminatory kind of practice not to have interventions to address higher education attainment. And this table here shows the kind of learners and by gender that we have. So at pre-primary, you have 1.4 to 1.4. At primary, that is grade 1 and above, before secondary school, it's 5.2 for male and 5 million for girls. In secondary school, we have 1.8 million for boys and 1.9 million for girls. But if you look at TVETs, you will see that the male is 228,000 and the female are 172. Compare that also to the universities, where you have 334,000 males to 227 females. So there's clearly need for intervention for higher education for females in Kenya. So if you look at the resource requirements, the education sector proposed an increase of 116.63 billion for primary education. The largest resource increase is expected or is requested for free primary education. That is 114.96 billion. So this is a summary of resource requirement and the expected increases where the money will be spent. So moving on to secondary education, the sector has requested an additional 22.57 billion. 21.5, which is a large share, will go to the free day secondary education. I don't know if you can hear me. There's some slight noise in the background.
Yeah, we can hear you, please, Josiah. And you have 5 minutes now.
All right. Let me proceed. So the going to the technical and vocational training, the sector requested an additional 10.14 billion. 7.38 billion of that additional amount will go into infrastructure development, and 2.4 billion to technical trainers and instructors in TVETs. Moving on to university education, the sector requested an additional 5.44 billion, and 43.68 billion will go to funding universities, and 10.16 billion to higher education support services. So we have some proposals for the education sector. So we have seen the recent developments in the sector, including introduction of the CBC, and which has meant a higher resource requirement for primary and secondary education. So allocating lower budgets than what the education sector working group means that the huge cost of implementing CBC will be transferred to households. Apart from locking out many children out of the education attainment, it will further add to the care burden for women and girls. The second proposal is that investing in early childcare and development for children of 0 to 3, 0 to 4 years is strategic to promote women's labor force participation, create employment in the childcare market, and also contribute to improved child welfare. The other proposal that we have is that the factors that prevent children from attending school go beyond inability to pay fees. And this has been shown by the, despite all the efforts to promote female education attainment, we still have few girls, few women in TVETs and education and universities. So we are proposing introduction of gender responsive approaches to promote learning in TVETs and universities. This includes prevention of sexual violence and harassment in institutions, implementation and development and implementation of gender policies, support for female leadership, and also addressing the care needs for the children of female learners. Perhaps one of the last sectors that we want to address, I think this has been addressed by previous speaker Anita, is on social protection, because lack of care for children, for persons living with disabilities, for the elderly, the burden falls back to the households, and households equals women, because once they're in the house, it's most probably the women and girls that are taking care of these persons. So one of the things that perhaps we would like to highlight about this is that apart from the usual cash transfers that the government has, it has also introduced the Universal Child Benefit Scheme, which targets specifically 0 to 3 children with support. But the coverage of this program is actually very small, about 8,000 children in the whole country. So it's also something that we are recommending the government should scale up. So other issues within the social protection sector include the issue of domestic work. The government plans through the National Employment Right Agency to promote in export of domestic workers. So it plans to enter into treaties with countries, especially those in the Gulf region, for exportation of domestic work. So it has things like pre-departure trainings and skilling on domestic work. However, this is missing in growing the domestic care work market in the country. So one of the proposals we're also making is that the government tailor makes those courses to also fit the local domestic care market. This, of course, will promote employment among those seeking employment in that sector. We are also asking the government to pay special attention to workforce compensation, because most domestic workers in the country are paid way below the minimum wage. So finally, we have additional proposals to address gender-based violence, and these mostly are in the governance, justice, law, and order sector. Mostly, we've seen that Kenya loses 46 billion annually due to, because of costs associated to gender-based violence. And so we're asking interventions around the sector to also focus on reduction of gender-based violence. Finally, other proposals to address unpaid care work. We propose tax measures targeting reduction of importation of certain household appliances. For instance, laundry equipment. This has the capability of addressing unpaid care work and also creating employment in this sector. The cost of energy as well, promotion of electric cooking, and also connecting more houses to the grid. Other proposals including to enhancing this access to water, irrigation, and also finally promoting accountability in budget spending. Thank you so much for your attention, and I welcome any other questions. Over to you, Raphael.
Thank you, Josiah, for your comprehensive proposals on key sectors touching on education, on domestic work, and some of the taxation taxation measures that you have shared that we that can be able to promote particularly the gender component. So thank you very much. I don't want to dwell into much because of time. I just now want to invite George Orido to quickly share with us his presentation on creative sector.
Okay, thank you, Muya.
Yes.
Good morning, everyone.
Good morning.
Now, thank you. My name is Jojo Rido, Director at the Institute of Creative Industry and Economy. I'm glad to be part of this year's pre-budget hearings at the Institute of Economic Affairs. I think this is a very important forum for us. And mine is a very short and brief presentation for this year. My presentation is the plan. What is it? What is in it for the creative economy? You remember the plan is the Jubilee. I mean the UDA Kenya Kwanza manifesto. And just a little bit of background is that the Vision 2030 has its social pillar that emphasizes on the need to invest in Kenyan's people by targeting a cross-section of the human and social welfare projects and programs, including the youth, sports, and the arts. The UDA, the plan, has its manifesto with a very robust plan for the arts in Kenya. And it is planning to establish a Department of the Arts first in Kenya so that it can domicile the ever elusive National Arts Council that would then spearhead policy and business environment for the arts. The appointment recently of Minister Ababu Namwamba, the useful Minister Ababu Namwamba, has really injected enthusiasm into the sector. The new Minister for Youth, Sports and the Arts is been very active and present both in the sports arena and the arts. I don't think he has ever missed a single important event since he was appointed minister. And the beauty also that he is having an open door policy for all stakeholders. So artists and art managers are able to access the minister to engage on matters creative economy, as it were. He has promised in many of his meetings, in speeches that have been covered very widely in the media, to establish the National Creative Economy Council, especially after the he held the National Creative Economy Conference in December last year. He has also been able to grace the Jama Fest. Sorry, yeah, he has graced the 40 million film production and development endowment funds. That was just last week when the government gave filmmakers a total of 40 million shillings in conjunction with the GIZ to make movies. And this is a new development. This is the third year that the Kenya Film Commission is doing this, and that is extremely good. And if you can remember in our past presentations, we made these proposals many times, and we're happy that some of these things are coming to fruition. He has also done a very nice thing, personally reaching out to corporates, chief executives of blue chip companies, and also meeting either ambassadors or cultural attaches from foreign missions to not only focus on sports, but also put some serious money into the arts. Yeah. Could you scroll a little bit up because I'm reading from the screen? Um, so what? Okay, up again. Scroll up. You know, I don't know whether scroll up and scroll down means the same thing, but I want to read from behind a little bit. Yeah. Okay. So go. Okay. Thank you. A little bit down on the issues. Let's go to the issues. Yeah. So what are the issues? The issues in our industry are many, but I chose a few to just enlighten um, uh, what are the things that we want to push for this year. And on that note, I just want to say that one of the biggest problem is pesa mfukoni. The plan emphasizes on emphasizes on pesa mfukoni, which means money in the pockets of artists, and that has been the big problem. Our main issue is pesa mfukoni. There's a lot of work, a lot of creativity, but very little money in the pockets of artists. Maybe just to don't troll yet. Maybe just to give you a perspective. For those of you who watched Wakanda Forever, where Kenya's own Lupita Nyong'o, the one who won the first woman, actually the first black African to win the Oscars in her very good, show as Patsy in Steve McQueen's 12 Years a Slave. She was in Wakanda Forever, and she was a supporting artist, but she was the highest paid. I think she was paid around 300 million shillings, a whopping 300 million shillings to this Kenyan girl. Um, and that is a good sign that things can be possible. So, what are the issues? Each one of us, or most of us, have what we call a schizotype. And schizotypes are music basically done by our artists. It's run on a Safaricom platform most of the time. And to date, Safaricom takes a lot of money, about 70% of the money you pay. Uh, that is usury, that is exploitative. And as a result of that, you realize that the artist at the end of the day gets just 10% because you still have middlemen in between, content management organizations, they are producers, I don't know who. And then there's very low share of the social and arts endowment fund that was established some time back, where the syntax on betting would then make that money. About a year ago, the then Minister Amina Mohammed had announced that about 31 billion shillings had been collected in that fund, and nearly 28 billion had been given to sports. So the arts is only getting up to 5%, and that is depriving the opportunity to invest in the arts and make the creatives do what they're supposed to do, create jobs for themselves and create wealth and establish wealth in this country. There's flooding of free tax-free international commercials in TV dramas. Some of these commercials you watch that promote products are shot in India and then played here without paying any tax. You watch the Alejandro's TV dramas that come from Venezuela and Mexico, and they don't pay any taxes. These things come through some very micro SDs, in the pockets of TV managers, and the taxman never really realize what they're allowing into the country. So that's another problem, because then we're having unfair competition for producers who are producing locally, who are investing a lot of money to produce just one episode of a TV drama is nearly 500,000 shillings. Then you have these guys who are bringing them for nearly for free, and flooding the market and depriving the Kenyan creative from space. Just scroll a little bit. Okay, there. There's and then, other than the TV dramas, our radio stations and even TV, they play a lot of foreign music. Got a lot of South African music, a lot of Niger music, yeah, and there's been a push since uh, Rafael Tuju was Minister for Information, where he was pushing for 60% of local content being played by radio in TV. That problem still persists. There's lack of transparency among the content management organization, the way they distribute royalties. You're talking about the music copyright side of Kenya, performing rights as Kenya, Prisk, and you realize that the amount of money they collect, uh, they use about 80% in administration and only give 20% to artists. It's unacceptable, and something must be done. Then in their own selves, and Kekobo is running this show. These CMOs hardly have capacity to collect monies or royalties. It's been long since you get businesses uh, having their licenses or matatus for paying money to MCSK, partly because also we have three of them, and at times it becomes very confusing to the consumer who to pay and who not to pay. Of course, there's a big lack it's a yawning gap of creative infrastructure. If you look at the Kenya National Theatre, in as much as President Uhuru Kenyatta's administration did a very good job by engaging Kenya breweries to bring in 100 million shillings to rehabilitate the theatre, and it has made it more viable now, but the capacity is below 400. You go across countries that take creative industry seriously, compared just to Nigeria or South Africa, or where it happens biggest in the US. Theaters are big, and there's been a plan and proposal to put up a 5,000 capacity ultra modern facility in the land that was just reclaimed from grabbers, the Kenya National Theatre, and no one has been talking about that since. And there's also been a proposal to have theaters in the counties. Hardly do you find theaters if you're not in Kisumu, Nakuru, or Kisumu when you're outside Nairobi, and that's a big deal. Um, uh, of course, the general exploitation by creatives, when a lot of creatives enter into contractual engagement without reading the I's and the dots, make a big difference in what they're committing in. They hardly have capacity to have lawyers for themselves to read into these documents. Then later on, they realize they sold the family golden plate for a song. Proposals. There's need to have one CMO. The MCSK and the priests need to put their house together. The Kekobo must just reorganize this environment and say we only have one CMO, so that when you have a CMO coming to collect money from organizations, they don't have to replicate and make the collection of royalty complicated. And therefore, then also improve accountability. And this, in our view, will improve the lot that is the artist in Kenya. Uh, there's an immediate need to establish the National Art Council. We're glad that the Minister, Babu Namwamba, is very committed to this. From the last month's National Creative um, Economy Summit held at the Kenya Cultural Center, if whatever he said is anything to go by, I think this is something that is realizable. Uh, there's need to change the law, whatever the statutes are there, to increase the revenue share of the artists to 60%. And the platforms like Safaricom must engage artists directly and kill the middleman. Because at the end of the day, uh, the artist is just remaining a slave, and other people making money of what is the sweat of their brow. Uh, increase social and arts fund share well, to the arts from 5% to 50%. And that's, as the name suggests, is for the arts and in sports. So why don't we have 50% for sports, 50% for arts? The last time we checked, healthcare came in and took a lot of money from that fund. And there's a big furore. Why would that money go there? Impose tariff barriers on externally produced commercials and TV drama, so that it's less attractive to get those, the Alejandro kind of drama onto our screens. You can stop them, but introduce. In any case, this government is into looking for opportunities to increase their tax collection. We are giving them an opportunity. There's a lot of money lying in there that they can improve the amount of collection of taxes for public use. Um, increase more funds to the Kenya Film Commission, especially for the Film Endowment Fund. I think the CEO that is there and the leadership, Mr. Timothy Owase, has done an extremely good job. And it is important that in this industry, when something is working, then it has to be magnified. So Kenya Film Commission need to get more money for their fund because it is very well utilized, and we're seeing a lot of movies that is originally Kenyan creations coming through like it's never been there before. And the Kenya Cultural Center that now works with people who do live stage performance also need to establish that kind of fund, and that kind of fund need to be supported for those theater artists who are doing stuff on stage. Um, establish basically a policy document. I know there's the Kenya music policy, the Kenya cultural policy, and the Kenya film policy that has been collecting dust at the cabinet office for years. These policy papers are supposed to help with establishing standards of engagement with the artists in Kenya, and maybe introduce even minimum wage, so that we don't have popular artists, people who are big celebrities, dying in squalor. As for us who are consuming their products, still enjoying life and making it big. Can you imagine ever, you people, life without music? A radio station without music. Can you ever imagine it going out and there's no music in a restaurant? Can you ever imagine? And because you need this, you need to pay for it. Kenyans must learn to pay for art because they love to consume it. And therefore, because Kenyans don't want to do it freely, we need policy and laws to compel them to pay for what they're consuming. Let's scroll a little bit up. Number 8. Okay. So invest um, um, The government of Kenya must invest in money to establish film hubs. Like the Kenya Film Commission already done that in Nyeri and Bomet, and I think there's a third one, which I'm not able to remember right now, where it's a good thing to have these hubs across the country and in collaboration with the county government to establish creative centers, which then helps with the infrastructure. And I always tell people, Kenya would not be big in coffee if we didn't have established infrastructure for coffee. Kenya will not be big in tourism if we didn't have national parks protected by government. And then now the private investors invest in hotels and hospitality. So we need to have infrastructure established for the creatives. Then the private sector can now come in to support the productions and stuff. With those many remarks, I would like to end it there.
Thank you, George, for your presentation. I think you have done justice to the sector, because what you have done is just to give an overview of their interest from the current government in terms of the creative sector. And what you have said is that, yes, I think the manifesto of this government addresses issues to do with the creative sector. Number two, you have been able to identify some of the issues which affect the creative sector, and one of them is the flooding of tax-free international commercials and TV drama, and too much of foreign content in the Kenya airwaves. I think you have been able to identify some of the issues that affect the creative industry. And then you have shared with us some of the proposals with respect to that particular sector. And one of the proposals that have caught me is that we need, as a country, to establishment of the National Art Council, which then will be able to promote this particular industry. And number two is that we need to invest in the establishment of more film hubs. Not only the one in Nyeri and Hub, but in each and every county in this country. So thank you very much for your presentation, and we hope you have mentioned that you'll be able to share a comprehensive brief on the same, so that we are able actually to incorporate all the views in the main document to share with the National Treasury. I'll give an opportunity for we have a back and forth for 10 minutes. And I have seen some comments and some questions. So if anyone have a clarification or comments, there is a facility. You can be able to raise your hand, or even you can be able to type your question in the chat box. In the meantime, I think we have some concern, and one of them is from Purity. And the Purity concern is asking whether the KK manifesto is explicit on community health volunteers, and is there a budget line on the same? I think that question, Jemima, would be able to address that, and any other panelist. And then the other question is on the financial year, asked by Purity again. She asked, in the financial year 2022-2023, there was a proposal for the establishment of a gender-based recovery centers. I have not seen any statement on the same. Is it possible to include this under the health proposal for the financial year 2023-2024? I have seen some back and forth between Dalmi and Jemima on the same. So Jemima, you can be able also to address that. And then a concern from my colleague Dalmi at Jemima: are there any plans by the Ministry of Health to evaluate progress made under the medium term 3? Just stock taking in terms of the health sector. Then I think Jemima has been able to address some of the concern, but if there are no questions, because I can't see anyone raising his hand, those are the questions that have been have been raised. I think yes, there is another one from Stephen Jairo, my colleague, to Dr. Aurido. How feasible is the proposal to top up the percentage from 5% to 50%? So Jairo is asking about the feasibility of actually the proposal of raising royalties from 5% to 50%, the feasibility. I think he's questioning about the gap from 5 up to 50%, 45 percentage mark. And then there was a question on by Purity on the strength of this is a sexual and reproductive health on this budget is one thing. She's just concerned about the issue around the sexual and reproductive health. She says that it is one thing, and the current data by NASCOP threatens the workforce of this country's future generation. The Ministry of Health as a regulator should be intentional in addressing this triple threat through budgeting to support intervention. I think again that that's a question that is addressed to Jemima. From my head, I think one of my concern, and this is to Orido. One of the concern I want you to address is just the question of what are there any tangible efforts in the sector in terms of partnership so that we can see some growth. I know you mentioned about the previous regime making sure that there is some aspect of some partnership. What do you see? What do you see in terms of partnership going forward? And because they are no more concerned, I think I will now give our participant an opportunity perhaps to address any issue that you might think that you can be able to handle and the question that has been raised, and then you can mention your last comment. And I'll reverse the order. This time around, I'll start with Dr. George Orido. Orido, it's your time.
Hello. Okay. Thank you, Raf. Okay. I'm still pursuing my doctorate, but it's good. You want it done immediately, Muya. So those are good prayers. I'm almost done. Now, to respond to Jairo asks whether it's feasible to increase the social uh, and art fund from 5 to 50 to the artist. Well, what is difficult about that? The artists are doing just as much as the sports. In fact, sports has a lot more resources. They get a lot of money from FIFA, and they have a lot of money from corporate. Some of these clubs are based on parastatals and companies, so they have their own money already. Arts, on the contrary, are they're on their own. And don't forget about the social pillar of the Vision 2030, that we need to invest in our people. When we invest in the arts, we invest in telling our own stories. We are creating a national identity. We are creating a national psyche because the economy is the people. People believe in themselves as a country, as a nation, and therefore, uh, the change of 5% to 50% is just adding a zero next to the 5, and it becomes 50 instead of 5. And the money, the capacity to handle that money is there. There are many young people. I've told people many times that the arts is the latest frontier for job creation. And even the plan, President William Samoei Ruto's plan, is to create more jobs. And there's opportunities, big opportunity to create employment in this area. So it's very feasible. It is not just a dream, it's something that is need, and we need to do it now. Uh, so that is my answer for you, Stephen Jairo. And to you, Raf, um, uh, partnerships in the arts is a must, and therefore that's why I was saying the minister is doing already a very good job. He's summoned let me use that word for lack of a better word. Um, he has summoned uh, ambassadors, cultural attaches from different embassies. You know, just previously, Ababu was the CAS for Foreign Affairs, and therefore I think he's using those connections to bring the goodwill to the arts in the ministry. And he's been telling them in no uncertain terms that they need to put in a lot more money in the arts because already they're already doing something with the sports, and he's doing the same with the corporate CEOs. Just I think 2 days ago, he was meeting the ABSA CEO, and he told the ABSA CEO, "Man, we know you're doing a lot for this for sports, but we need a little bit more for the arts." And therefore, and you know, a lot of these foreign organizations, whether it is Alliance Française, for example, the biggest art center in this country is Alliance Française, where you can be assured of a nice film on a Monday, and a beautiful performance of theater on a Friday, and then a nice music performance, live music performance on a Saturday or Sunday. It's Alliance Française. Alliance Française is under the Ministry of Foreign, I mean, it's under the embassy of the French government. The same story with Goethe Institute, the same story with the American embassy, and even the Dutch embassy. So there's been partnerships, and I even mentioned that the National Theatre was renovated by money from Kenya breweries, with a partnership between uh, breweries and the government on the legacy projects then of President Uhuru Kenyatta. So it's a good question. It's happening, but we need to do more, and we can only support the minister by not only echoing this, but also individual artists and art managers and fundraisers reaching out to partnerships. Thank you.
Thank you very much. Then we go to Josiah. Your final comment and any issue that you might be able to address raised in the chat.
Thank you very much, Raphael. I don't see any issue that has referred to me on the chat, but just to say that there is a unique opportunity that we see us in the social development of one promoting economic sort of performance and growth in the country by bringing in the care economy as a contributor to recognizing the contribution to the economy and also creating employment within the sector. It's an area that the government has not paid attention to, but an area that it has identified especially in the foreign markets, exporting for domestic labor. But our observation is that it's still lucrative when done locally. And so interventions by all these agencies that are exporting it should also have components on ensuring that we have a skilled care workforce, and also one that is able to get benefits from the work that they do. So thank you very much, George, and IEK, DADMI, for organizing this. And we look forward to the next discussions on this topic. Thank you.
Thank you, Josiah. Then we go to Anita.
Thank you, Raphael, and thank you for the opportunity to present today on the place of children in the budget in Kenya. And just to note that this year, the theme of the Day of the African Child is to increase budgeting for child rights related issues. So this webinar was quite timely. And my hope is that we continue this conversation so that we ensure that children are catered for as a distinct party in future budgets in Kenya. Thank you.
Thank you very much, Anita. Finally, Jemima Modoni.
Thank you. Thank you so much. I think I begin with commenting on the GBV centers, Purity referenced. GBV centers would lie with the Ministry of Social Protection, Culture and Recreation, but I believe there's opportunity to capture them in the proposal asks here and very specific to that sector. On the issue of CHV's advocacy and the question of whether there's a budget line for CHVs, I think as the budget work begins, the advocacy is on us for one to have a national legal framework for CHVs. There is a revised strategy, the Community Health Services Strategy of 2020, but currently we have a lot of county-specific legislations in terms of having CHV bills, CHVs acts, and these were supposed to allow for I don't call them I think they're stipends. Nobody is being paid. The Kenya Kwanza manifesto proposes to employ them. Now, employment means they are no longer volunteers; they are community health workers. So it would also be interesting to shape our advocacy. What will be the scheme of service under MOH, or where will it be? Where is the national legal framework to anchor this? I think the opportunity is here with us to advocate and to push the government to come through on this commitment for CHVs. On sexual reproductive health, I don't know whether Purity is still in the room. If you have a specific ask in terms of sexual reproductive health, I will capture it in this memo because I still have it. I've not not memo, the brief. I still have it. I've not yet submitted it. There is opportunity to capture that. So Purity, if you're in the room and you're able to articulate or to provide more clarity on the ask for sexual reproductive health. Josiah says CHVs are on the budget and a volunteerism program in the State Department for Social Protection. Okay. Purity, are you in the room? If Purity is not in the room, the SRH and investments towards ending triple threat, that will also be captured in the brief. Have I addressed everything, Muya?
Yeah. Yeah, I think you have addressed all the issues that we are raised. Just your last comment, please.
Okay. Thank you so much for the opportunity to be here. I think HERAF in the past has been represented by Christine. So this was my first time in a long time engaging on this platform. I think initially IEA used to support similar activities at county level where we've been able to carry on the work in terms of consolidating proposals for the county government. So thank you. I look forward to participating at this national level, and of course being able to articulate national levels more broadly. This is also a learning space. I'm happy to be here. Thank you for the opportunity.
Thank you everybody for participating in our forum. I want to take this opportunity particularly to thank our presenters. I think you have done justice. You have done a fantastic job by sharing with us, by a way of sharing with us budget proposals, which as an institution, what we normally do is just to synthesize those proposals in compliance with the guidelines that are provided by the National Treasury, so that they do have a compelling case when presented to the National Treasury. They will be able perhaps to pick a few, not all, so that they are incorporated in the main document. So thank you very much, and we hope in terms of engagement, we'll get back to you in case of any clarification of any specific issue. Number two, budgeting is about trying to balance the act between what the government expects in terms of resources and what the sectors need actually to use. So it's about trying to make sure that you balance between the revenues that you're supposed to collect and the expenditures, and choices have to be made anyway in terms of the programs that you want to implement. So as an institution, what you'll do is that out of all these proposals, and I mentioned as we started, is that yesterday we received proposals from the corporate sector, majorly taxation proposals, and today social sector, the proposals are expenditure oriented. So we are going to create that balance, and once we've synthesized all these proposals, we are going to prepare a memorandum which we will then share with the National Treasury. And later, before before the estimates of expenditure are actually tabled in Parliament, I think as an institution, what we will do is that we will launch this memorandum, which we normally call the Citizen Alternative Budget. So you have an opportunity to see which are some of these proposals that we shared with the National Treasury, so that at least we have a feedback in terms of checking what aspects of our proposals were picked by the various sectors together with the taxation proposals. So I apologize again for keeping you. We had promised that we are going to finish before at 11:30. It's almost 20 minutes past noon. But two things is that Institute of Economic Affairs will be holding further forums. So we are encouraging all the participants who are here to keep in touch with us and follow our social media, which will be communicated by our communication department. Number two is that IEA is a membership organization. In case you wish to join the institution, kindly keep in touch with our communication department. So I want to thank all of you, and I want to wish you a wonderful afternoon. Thank you very much.